sagittal section through a male pelvis, showing the primary sex organ testis and accessory structures. Testis is located in a cutaneous outpouching called scrotum. The scrotum is divided by scrotal septum into two chambers, two sacs, two chambers you can see, it is one sac. And you can see a structure called epididymis, looks like an inverted comma, hugging the testis from the posterior border. And then a system of ducts that would include the ductus deferens or vas deferens, ductus deferens, that will arise from the epididymis, ductus epididymis. Then this vas deferens will join with the duct of seminal vesicle to form ejaculatory duct. Now, these seminal vesicles, prostate gland and bulbourethral gland or corpus gland, these glands are accessory sex glands that secrete substances that aid in reproduction, that aid also, that play a role in providing nutrition or nutrients to the sperm cells. You know about these ducts like prostatic urethra, membranous or intermediate urethra, penile or spongy urethra, and then external urethral orifice. This is the copulatory organ or the penis, formed of 3 erectile tissues, 2 corpora cavernosa and 1 corpus spongiosum. You will learn about them more. You should give a reading also. So that is about the gross anatomy of male reproductive system. Now what happens, the testis in the fetal development, testis arises inside the abdomen, but it was too hot for it. The testis, while getting developed, said, I hate this heat, I want to get hell out of here. I'm just exaggerating. So testis began to descend. And ultimately there is a canal called inguinal canal through which testis travels. Sometimes testis can get stuck here. Traffic jam. So sometimes male babies are born with no testis inside the scrotum. So the doctor and the nurse, and they make sure that the thing is there. If it is not there, and I'm trying to make it dramatic. If it is not there, no problem. A condition is called cryptorchidism. I mean, the testis is playing hide and seek. Oh, I'm not going to come out. So when the baby is 1 or 2 year old, it can dislodge by itself, or if not, then a minor surgery is needed to put it inside the scrotum. It's a minor surgery. No problem. Why? Because the core body temperature is not conducive to the production of viable sperm. And that's why a temperature difference is needed. At least 2 to 4 degrees temperature difference between the core body temperature and the atmospheric. So the testis is outside the body cavity, but there is a connection. And some muscles, abdominal, internal oblique muscle, has an extension called cremaster muscle that is attached to the testis. And I will show you in another diagram that cremaster muscle regulates the temperature control, okay? Didn't I tell you about the cremaster muscle? Look, internal oblique muscle extends through the inguinal canal. It's been wrapped up. There's, the testicular veins, testicular artery, vas deferens or ductus deferens, cremaster muscle, everything wrapped up into a connective tissue sheet, and the structure is called spermatic cord. Okay? You can see that how the surface of the testis is attached to the cremaster muscle. So when the muscle contracts, testis is drawn toward the body cavity or toward the body. When it relaxes, so during summertime, I'm not talking about summertime in the North Pole. I don't know why I am doing this. This is for the first time telling you this. Believe me, I have never told my students. And sometimes something just gets into me, and I go banana. So during winter times, what will happen? This will be mostly contracted because testis would need warmth of the body too. Okay, but during warm season, what will happen? The cremaster muscle will relax. So temperature control is there for the testis. And that is by the contraction and relaxation of cremaster muscle. Now, look at this testicular artery, which can originate from the abdominal aorta. Okay, abdominal aorta. Yeah, it originates maybe from the posterior mesenteric artery. I don't know, maybe abdominal aorta. But when blood is brought into the testis by the testicular artery will have blood that will have temperature like the body temperature, isn't it? And if that blood is not conditioned, if the temperature is not brought down, then the whole purpose of having the testis in the scrotum will be defeated, isn't it? So there is a unique system, heat exchange system. What is that? If you look at the testicular veins, they wrap around the testicular artery, forming called pampiniform plexus. Nice name to remember, musical, pampiniform. Yeah. What happens there? It contains venous blood, the blood returning from testis. Naturally, the blood that returns from testis will have lower temperature than body temperature, isn't it? And testicular artery carries the blood from body cavity that will have higher temperature. But during the passage through the pampiniform plexus surrounding the testicular artery, a simple law of physics called heat lost equals heat gained. Like you learn, fluid loss equals fluid gain. Here, the heat is lost to the testicular vein blood from the arterial blood, and heat gained by the venous blood from the arterial blood. You get that now? This is a heat exchange, unique mechanism, isn't it? So when you look at the organization, you appreciate the function. Okay? So one of the important structures that you need to identify would be pampiniform plexus. Pampiniform plexus. Spermatic cord. Cremaster muscle. Testis. Epididymis. Scrotum. Scrotal septum. Here, there is a cross section through the penis showing 3 erectile tissues, 2 corpora cavernosa and 1 corpus spongiosum. Okay. Now, cadaver dissection. Here is the diagram developed from the dissection, and you need to pay attention here. Since testis originated inside the body cavity, naturally it should be surrounded by peritoneum, visceral peritoneum, isn't it? Or serosa, the visceral peritoneum. So testis is surrounded by the serosa called tunica vaginalis. Immediately below tunica vaginalis is the tunica albuginea, white fibrous tissue, tunica albuginea. And then from tunica albuginea, these are the septa, singular septum. These septa divide the testis into about 200 lobules. These are testicular lobules. In each lobule, 2 to 3 tightly coiled tubes called seminiferous tubule. Seminiferous tubules are the sperm making factories. Okay? Now, the seminiferous tubules, highly convoluted, then the seminiferous tubule becomes straight. Look here, called straight tubule. Straight tubule. All these straight tubules, they form a network called rete testis. This is the rete testis. Rete is network. And from rete testis then arise afferent ducts. Look here. These afferent ducts form the epididymis. That has 3 regions: the head of the epididymis, the body of the epididymis, and tail of epididymis. But epididymis is an accessory structure, not a part of testis. The testis ends here in rete testis. So sperm will be liberated, will be produced by the seminiferous tubules. They will be released in seminiferous tubule lumens, from there to straight tubule, to rete testis, to afferent ducts, and then this will form the ductus epididymis. Ductus epididymis, from the tail region, it will increase in diameter. It will become straight, uncoils here, and becomes straight. From this point onward is called ductus deferens or vas deferens. Okay? The removal of vas deferens is called vasectomy, which is the what is called invasive method for male contraception. Okay? But sure method. Yeah? It can be